Almost since the pandemic began, we have told you about those staffing shortages at nursing homes.
And now some facilities are freezing admissions. Nadine Abushara explains the impact this is having on others.
As some parts of the state are seeing a ray of light in the fight against COVID-19, others are dealing with the same battles.
Just yesterday, we had our second highest day for hospital admissions on record. So despite some encouraging signs, our hospitals remain strained, and hospitalizations are still rising in southern and western Ohio.
What makes the fight even harder is not having enough healthcare workers.
It's not only the cases that have skyrocketed, but also the staffing shortages that have really strained the systems.
Those shortages aren't just in hospitals, but also in skilled nursing homes, where hospitals will send patients for continued care.
The impact right now is particularly significant as it relates to staffing.
Pete with the Ohio Healthcare Association tells News 5, right now there are more than 4,000 long-term healthcare workers out due to COVID. That's on top of the list of staff members that quit.
And then when COVID hit, we had just a lot of people who left the profession, collect unemployment because they were tired of being beaten up on.
Which in the end causes facilities like Welcome Nursing Home to put a freeze on their admissions.
It's, not something we like to do, but certainly if we feel that we're at a capacity that our staffing can manage, and going over that would put anybody at risk.
That freeze also halts hospitals' ability to transport patients from the ER or the ICU to another care facility, holding up hospital beds.
The next person who comes along and has COVID or something else and needs a hospital bed, they may not be able to get in. They may have to be diverted to another hospital or sent home.
For Jill, they say they know their role, but can't take more than their already shortened staff can bear.
We recognize that we're a partner in the whole healthcare system. And if with any resident that we can take from a hospital, it leaves an open bed for a new patient in the hospital environment. So we take that very seriously, but we don't want to do anything that we wouldn't be able to manage.
Right now, they're managing with more than 12 staff openings.
Some people come and work just 4-hour shifts because that's what works in their home life. And we're doing creative staffing that we've never done before.
They do have their admissions back open, but Jill says it will close again if they feel they don't have the staff to care for their residents properly. Reporting in Cleveland, Nadine Abushara, News 5.